Congestive heart failure, CHF, is a serious, chronic condition that affects millions of people worldwide. It is often misunderstood, as the term heart failure sounds like the heart has completely stopped working, which is not the case. Rather, CHF means that the heart is no longer able to pump blood effectively to meet the body's needs. This inefficiency leads to a buildup of fluid in the lungs, liver, abdomen, and lower extremities, causing a wide range of symptoms that can drastically affect quality of life. According to the American Heart Association, more than 6 million adults in the United States are living with heart failure, and this number continues to grow due to increased life expectancy and rising rates of conditions like hypertension and diabetes. CHF is a progressive disease that requires early detection, proper management, and long-term lifestyle modifications to improve outcomes. In this article, we will cover everything you need to know about congestive heart failure, its definition, pathophysiology, symptoms, treatment options, and preventive measures. What is congestive heart failure? Definition. Congestive heart failure is a condition in which the heart cannot pump enough blood to supply oxygen and nutrients to the body's tissues. This happens because the heart muscle becomes weakened or stiff, reducing its ability to contract or relax effectively. Unlike a sudden cardiac arrest, which is an abrupt stoppage of the heart, CHF develops gradually and worsens over time. The term congestive refers to the fluid buildup, congestion, in the body due to poor circulation and backflow of blood into the veins and lungs. Key characteristics of CHF. The heart struggles to pump efficiently. Blood backs up into the veins, causing congestion in the lungs, leading to shortness of breath, and swelling in the legs and abdomen. The body receives less oxygen-rich blood, causing fatigue and weakness. Types of CHF. 1. Left-sided heart failure. The most common type. The left ventricle fails to pump blood effectively, causing fluid to back up into the lungs, pulmonary congestion. Symptoms: shortness of breath, cough, difficulty lying flat. 2. Right-sided heart failure. Often caused by left-sided failure. The right ventricle cannot pump blood to the lungs efficiently, leading to fluid buildup in the abdomen, legs, and feet. Symptoms: swelling in legs, weight gain, ascites, fluid in the abdomen. 3. Systolic heart failure. The heart muscle becomes weak and cannot contract forcefully. Low ejection fraction, EF, typically less than 40%. 4. Diastolic heart failure. The heart muscle becomes stiff and cannot fill properly. Preserved ejection fraction, normal EF, but reduced relaxation. Explanation: how CHF develops. To understand CHF, it's important to look at how the heart normally works. The heart has 4 chambers, 2 atria and 2 ventricles, that pump blood in a coordinated manner. The left ventricle pumps oxygen-rich blood to the body, while the right ventricle sends oxygen-poor blood to the lungs for oxygenation. In CHF, the heart muscle becomes weak, due to damage, or stiff, due to scarring or aging. Blood flow slows, leading to congestion in the lungs or peripheral tissues. To compensate, the heart beats faster and enlarges, cardiac remodeling, but these mechanisms eventually fail. Common causes of CHF. Coronary artery disease, CAD, narrowed arteries reduce blood flow to the heart. Hypertension, high blood pressure, increases strain on the heart. Heart attack, myocardial infarction, damages heart muscle. Valvular heart disease, faulty valves affect blood flow. Cardiomyopathy, disease of the heart muscle. Arrhythmias, abnormal heart rhythms impair pumping. Diabetes and obesity, increase risk and strain on the heart. Risk factors. Age, risk increases with age. Smoking. Excessive alcohol or drug use. Sedentary lifestyle. Family history of heart disease. Symptoms of congestive heart failure. CHF symptoms can be mild at first but worsen as the condition progresses. They often vary depending on whether the left or right side of the heart is affected. Common symptoms: shortness of breath, dyspnea, especially during activity or lying flat. Fatigue and weakness, due to poor circulation. Swelling, edema, in legs, ankles, feet, and sometimes the abdomen. Rapid or irregular heartbeat, heart palpitations. Persistent cough or wheezing, often with white or pink-tinged mucus. Weight gain, from fluid retention. Reduced ability to exercise, even simple tasks feel exhausting. Severe or advanced symptoms. Difficulty breathing at rest. Frequent nighttime urination. Swelling in the abdomen, ascites. Chest pain, if heart failure is caused by a heart attack. Treatment of congestive heart failure. There is no complete cure for CHF, but treatments can manage symptoms, slow disease progression, and improve quality of life. Treatment usually involves a combination of lifestyle changes, medications, and in some cases, surgical interventions. 1. Lifestyle modifications. Low-sodium diet reduces fluid retention. Fluid restriction prevents fluid overload. Regular exercise improves heart strength, doctor-supervised. Weight management prevents excess strain on the heart. Quit smoking and limit alcohol, essential for heart health. 2. Medications. ACE inhibitors, e.g., lisinopril, dilate blood vessels and lower blood pressure. Beta blockers, e.g., metoprolol, slow heart rate and reduce strain. Diuretics, e.g., furosemide, remove excess fluid from the body. ARNIs, e.g., sacubitril/valsartan, newer class for advanced CHF. Aldosterone antagonists, reduce fluid buildup and strain. Anticoagulants and antiarrhythmics, if needed. 3. Devices and surgical treatments. Implantable cardioverter defibrillators, ICDs, prevent sudden cardiac death. Cardiac resynchronization therapy, CRT, coordinates heart contractions. Left ventricular assist device, LVAD, mechanical pump for severe cases. Heart transplant, last resort for end-stage CHF. Prevention of congestive heart failure. Prevention is always better than cure, especially for a condition as serious as CHF. Primary prevention. Maintain healthy blood pressure and cholesterol. Eat a balanced diet rich in fruits, vegetables, and whole grains. Exercise regularly, at least 30 minutes most days. Avoid smoking and excessive alcohol intake. Maintain a healthy weight. Secondary prevention. For people already at risk or diagnosed with early heart disease. Take medications as prescribed. Regular checkups with your doctor. Monitor symptoms and weight daily. Use home blood pressure monitors and heart health apps. Conclusion. Congestive heart failure is a life-threatening condition, but with early detection, proper treatment, and lifestyle changes, many patients live longer and healthier lives. Understanding the disease, recognizing symptoms early, and taking proactive steps can make all the difference. Remember, your heart is your engine, take care of it before it fails.